efficacy of pranayama breathing in COVID-19, a prospective study with retrospective control group conducted at dedicated COVID hospital in 2020. As you all are aware that COVID-19 pandemic is a global challenge to public health, and this virus had mainly affecting respiratory system. This virus has challenged our humanity and the medical fraternity to a great extent, and there was a prevalent fear at the beginning, as we all are aware. And during that challenging time, based on our personal experience while working in our busy COVID isolation ward, when a pranayama technique, a type of chest physiotherapy, when implemented, there appeared to be a great improvement in an oxygen saturation level of the patient. Hence, in order to study the efficacy of this technique, this study has been undertaken with primary objective being prevention of progression of disease from mild, moderate to severe stage, while the secondary objectives were to study the effect of this add-on technique with respect to restoration of health and reduction in duration of hospitalization, reduction in anxiety, and reduction in mortality. Approximately 300 patients were screened for the eligibility criteria, of which 278 patients were included in study group, 139 were in study, and 139 in control. The study was explained, informed consent form was served. Study group received pranayama breathing as an add-on to conventional therapy with approximately 22 breaths per cycle 3 times a day for minimum of 28 days. And follow-up was done on day 1, 3, 7, 14, and 28 days of enrollment. Outcomes were compared to the historical control group prior to introduction of this treatment, with one ensuring 1:1 matching with respect to age, clinical stage, comorbidity. The highlights of our results of our trial are the pranayama treatment patients with the effect of pranayama. As we can see here, with the first pranayama, the mean oxygen saturation level has raised markedly from 95.24% to 97.40% with first pranayama, and this difference was statistically significant at p-value of 0.001. Besides, we found that there was progressive reduction in the requirement of supplemental oxygen in study group, pranayama group, while in the control group, there was progressive increase in the requirement of supplemental oxygen. And this difference was statistically significant at p-value of 0.001. As we can see in this graph, none of the patients in pranayama group received and supplemental oxygen beyond 11 days, while in the control group, the patients kept on receiving supplemental oxygen up to 28 days. The amount of oxygen required in pranayama group was significantly less compared to that of the control group, and there was around 69.3% reduction in supplemental oxygen requirement in pranayama group compared to control group. We also checked for prevention of progression of disease in control group versus the study group from mild, moderate to severe stage. And we found that there was prevention of progression of disease among the control group was 11.1%, while it was 93.5% among the study group. Hence, this prevention of progression of disease was significant in favor of pranayama group. significant at p-value of 0.001. Besides, there was average reduction in respiratory rate by 22.5%, average reduction in pulse rate by 10.2%, and average reduction in the anxiety score by around 18.4%. The intervention has also found to have resulted in 30% reduction in hospitalization in favor of pranayama group patients as compared to control group. There have been mortality of 7.2% in control group, while it was 0% among pranayama group. Thus, the study concludes that the incorporation of pranayama breathing has potential to prevent more severe form of the disease and has resulted in survival benefit based on the results of our child. Moreover, this technique is handy, inexpensive, profound, and effective tool. As such, it scenario in comprehensive management of COVID-19, especially in resource-constrained settings, as the intervention has also shown to have caused significant reduction in the supplemental oxygen requirement. Thus, our objectives were fulfilled. These are my references. Thank you. I thank organizers for giving me opportunity to share our results on this platform. I'm happy to welcome questions if they are.